I'm Dr. Deepthi Venkatesh, fertility specialist at GarbhaGudi IVF Center. So today let's talk about the role of IVF in females who have undergone tubectomy. For understanding this, first we need to know how a natural pregnancy occurs. In women who have regular menstrual cycles with cycle length of 28 to 30 days, ovulation occurs mid-cycle, that is on the 14th or the 15th day. At this time, if they have sexual intercourse, the sperm ascends through the cervix and into the tube where the egg is, and it is in this tube where the sperm meets the egg and the embryo formation happens. So this embryo grows in the tube for the first few days, after which it goes to the uterus and gets attached to the endometrial lining, thereby giving rise to a pregnancy and helping the pregnancy develop further. In tubectomy, in females who undergone tubectomy, what happens? These tubes are either cut, crushed, or a fallopian ring is applied to them so that the egg and the sperm do not get a chance to meet. So what does this mean for such couples? Is it the end of the road for them? No, there are quite a few options available. The first one being tubal recanalization, where we can attempt to reconnect the tubes and then hope for a natural pregnancy to happen. The success of this procedure depends on various factors. Over the years, we've seen that another option is IVF, wherein we get better success rates, especially in tubal factor infertility. So how does IVF help in these cases? In IVF, what we do is we stimulate the woman with hormone injections starting from day 2 or day 3 of the cycle, with daily injections for about 8 to 12 days. And once all the follicles are ready, that is, they're more than 18 millimeter, we give a final trigger injection and then retrieve or pick the eggs in the OT. Post this, we pass over this fluid to the lab, wherein they screen for the mature eggs and then inject each mature egg with a sperm. So this formation of the embryo, which naturally happens in the tube, is happening in the lab, and we are completely bypassing the tubes in this procedure. After this, the embryos are allowed to grow for 3 to 5 days in the lab and then placed back into the uterus in the same cycle or in a frozen embryo transfer, thereby giving rise to a successful pregnancy. So this holds very good promise for couples with tubal factor, not just tubectomy, if they have a tubal block or if they've undergone a salpingectomy as well, with success rates reaching almost as high as 60 to 65%, presuming all other factors are normal. So if you want to know more about this procedure or about any other fertility issue, kindly contact a fertility specialist at GarbhaGudi IVF Center and do follow us for more such videos.